Welcome back. All right, fellas, we don't like to talk about it, but we got to. The American Cancer Society says prostate cancer is the most common cancer among men after skin cancer, and if caught early, it's very treatable. So, here to talk about the latest research is Dr. Ali Kazraian with the Weekly Dose. Dr. Kazraian here, September's Prostate Cancer Awareness Month, and you've got a study that just came out in June. What did it say?
So, very interesting study. So we talk about prostate cancer, the controversies about screening. We've talked about a whole bunch. And obviously as a urologist, I believe that appropriate screening makes sense. So talk to your doctor about screening. If you're a high-risk African-American man, if you have family history, it's very important to start screening. And I think starting at screening at 45 for everyone is a good number to keep in your mind.
A year away.
Yeah. If you are a higher risk African-American male or family history, think about doing it somewhere between 40 and 45. You don't miss anything. The guidelines are controversial, but that's a safe way to go. What this study looks at is what to do if you find prostate cancer. And so that can sometimes be a very difficult thing for people to deal with. 40 to 45% of the prostate cancers that we manage are low risk, low volume, so you can monitor. Some are a little bit more aggressive, or people want to just have more definitive therapy in terms of removal of the prostate with a radical prostatectomy, which is most often done with a minimally invasive technique like robotics or radiation therapy. There are a lot of cancers that are the in-betweens that people are worried about the potential side effects of therapy for low volume disease that may be focal in an area. Could we just treat that? And so that's what this study deals with in a very interesting manner.
The removal of the prostate, what are the reasons you would want to do that?
So one, if you have a prostate cancer, typically, and this was one of the standard of care for men younger than 65, it has a very high success rate, and it's peace of mind that your prostate's out. Your PSA afterwards should be undetectable at about 8 weeks after the procedure.
But if it's gone, its function is also gone. So
So true. So that's what you worry about. The idea with focal therapy is that the more prostate you preserve, the more function you preserve. So could you potentially have some benefit of the therapy of that area without some of the side effects with more robust therapies. With radical prostatectomy, things people worry about are incontinence, difficulty with controlling their urination, potential effect on the erectile function. Fortunately, about 90% or so of people who undergo prostatectomy are able to control their urination about a year out. Erections, age and how your erections are beforehand are a big contributing factor. Radiation therapy, the size of your prostate, how you're urinating beforehand is an issue. So here, can we potentially just go treat the portion of the prostate? And the technology they looked at, which is great, is called HIFU, high intensity focused ultrasound. Use sound waves and ultrasound to destroy the prostate tissue, kind of like if you think about a magnifying glass. You take a magnifying glass, you try to burn a leaf. It takes a sunlight and pinpoints it into a small point, and you can direct that towards anything. HIFU is the same type of technology, so you can be very precise with it. And what they found here in a big 5-year follow-up study of more than 600 men is that you had 100% prostate cancer-specific survival, you had 99% overall survival. And another thing that's important is that you also had metastasis-free survival that was 98%, meaning people that were surviving without cancer out of the prostate. So when the cat's out of the bag, so far, even in 2018 going on 19, we don't have a cure. So that's a very important thing to be mindful, because that's potentially a painful way to pass.
Those 500 people in that study, what degree of prostate cancer did they have?
Great question. So 84% of these gentlemen had intermediate risk prostate cancer or high risk prostate cancer. And the way to think about that is 4 types of prostate cancer: rockets, rabbits, turtles, and snails. I kind of mentioned this all the time.
Yeah,
rockets are metastatic out of the prostate. So 98% of the men who were treated with this technology did not have metastatic disease through the therapy, but they didn't show up with that disease.
Okay.
Intermediate risk disease or high risk disease are those rabbits, cancers that are confined to the prostate, but they really should be treated to try to get the most benefit out of treatment to save a life.
Does that mean it's gotten to a size where it's starting to be concerning?
It's the size and also potentially the grade or how aggressive the prostate cancer is. Think of the prostate cancer is diagnosed based on this thing called a Gleason score. So think about 7 as a fence that divides aggressive cancers like 8, 9s, and 10s from 6, 5s, and 4s. And really these days the lowest that we see is a 6. So if you have those turtles and snails, which are the 6s, you can potentially monitor them. The risk of them getting out of the prostate is less than 1%. The risk of people dying out of their prostate is less than 1%, although a third of people that we monitor, their cancer changes. The 7s are the in-betweens. The 8, 9s, and 10s are the higher risk. So 84% of these guys were the 7s, 8, 9s, and 10s in the set. So they're intermediate and high-risk disease. So what this showed was their primary endpoint was failure-free survival, meaning that you didn't need secondary therapies such as a radical prostatectomy, you didn't need radiation therapy, you didn't need hormone ablation, meaning giving a shot to bring down the testosterone level. So that's the primary treatment for metastatic disease. And also they looked at, you know, cancer-specific mortality, making sure that you didn't die of this cancer. So with these gentlemen, at 1 year, 99% of these men had failure-free survival. At 3 years, it was 92%, and at 5 years, 88%. So what that shows is you're treating just a portion of the prostate. So some people are going to need repeat treatments in other areas of the prostate because it's a multifocal disease, but these men did not die, and this offers a very, very good outcome because almost 100% of these men did not have incontinence, and they had very, very few side effects, and they survived.
That's all great news. I always learn something. We could talk for much longer on this. It's an important topic. But appreciate you and your time. For more information on Dr. Kazryan, you can head to Dr. Kazryan's website, which is KazryanUrology.com, or you can listen to him live and call into his radio show, The Conversation. It is on WOKV, and it airs every Saturday starting at 5 p.m.